Dear esteemed delegates and senior faculties, on the behalf of the organizers, I extend a warm welcome to each one of you to the FOGCE Conference 2023. We are deeply indebted to all the faculties who have readily accepted our invitation and made time for this event today to delve into the evolving insights of infertility, obstetrics and gynecology, all based on the core principles of empathy, expertise and excellence. The driving force behind this event is encapsulated with the belief that we learn from each speaker and we help others to learn. With those in mind, we have curated a program that is not only insightful but also tailored to meet the educational needs of all participants. Your active participation, despite the weather challenges, is truly appreciated. It reflects your commitment to the advancement of the knowledge in these crucial fields. We are confident that the next few hours will be filled with enriching discussions, take-home points for the clinical practice, valuable networking opportunities, and sharing of cutting-edge research. Once again, thank you for being here and let us embark on this journey of knowledge and collaboration together. May this conference to be a beacon of enlightenment and inspiration for all. Wishing you a fruitful and engaging FOGCE Conference 2023. We are having a voting pad kept at each person's seat. This is used for quiz and also for opinion poll. We have opinion poll before the session where we want to get the inputs from the audience, what they feel about the topic. So you can also use it. There'll be a slide which will help us to tell how to use it. And whenever there is a question from the audience, we know that many of them are experts in the field who are sitting here. So kindly post your questions. There's a mic kept there. So you can ask your questions from there and the speakers will be able to answer. So you need to vote only after the timer music starts and answer within 15 seconds for the polling questions. No need to press send or link button, just press your option. You can vote n number of times, but your last response on the keypad will be taken as your final response. The number of correct answer and the faster finger will be the first. Please leave the voting pads on your table or chairs at the end of the session. If you're able to choose the same chair again and again for the quiz participants, it will be nice because at the end of the day we have a quiz answer winner being released and they'll be presented the iPad. So you're requested to occupy the same seats again. Thank you.
Be ready with your polling pads.
Cryopreserve oocytes according to ART guidelines 2022. Is it 5 years, 7 years, 9 years or 10 years? Your time starts now. Yes, it's 10 years, 59% voted for that. So let us move on to the next question. So how to calculate shock index? It is systolic blood pressure by heart rate or heart rate by diastolic blood pressure, or it is the difference divided by the systolic blood pressure, or you feel it's none of the above. So your time starts now. Okay, so it's none of the above actually because the shock index is calculated by heart rate by systolic blood pressure. Now only recently modified shock index is used. So the next question. So Mrs. X, a third gravida delivered vaginally, is suffering PPH and the obstetrician has asked for a Venflon and the sister has brought this grey Venflon. So what is this gauge of this? 24, 16, 18 or 20? Your time starts now. Yes, it's a great response. 16 gauge, yes. The next one. So, why aromatase inhibitors are used in the hormonal treatment of obese individuals with oligoasthenozoospermia? So, is it to increase estrogen, decrease testosterone levels, reduce the insulin sensitivity, or to give a hormonal environment favorable for a sperm production? Your time starts now. Yes, it is to maintain a more favorable hormonal environment. In spite of the pre-lunch sessions, everyone is rocking. Thank you. So, what emerging technology shows a promise for preserving fertility in pre-pubertal boys facing a cancer treatment? So, is it a sperm or a testicular tissue for cryopreservation, or in vitro maturation of sperm, or artificial insemination? Your time starts now. Great, it is testicular tissue cryopreservation. Thank you for the participation. Let us see the fastest and the first fingers now. Please display the results. Yes, 45. Keypad number 45.
Please come and collect your prize.
Please, yes.
Dr. Ramkumar sir, Clinical Excellence Officer, will present the prize.